All right, hi all of y'all. My daughter has graciously said that she would be the patient today, but when I am actually assessing y'all during your assessment, you have 15 minutes or less to do it. Be sure you get all the points that are on the rubric, and if you finish in less than 15 minutes, you can go back and finish your assessment. So we managed to get our massage table, got a gown from work. I've got my
Daughter from 20 years
fake
ago.
pen light and a little plastic knife as my tongue depressor. So, gotta be creative in nursing. All right, so we're gonna go ahead and get started. Okay, knock knock. Hi Lydia, I'm Cynthia. I'm your student nurse today. How are you feeling?
Well,
Good. Okay. If it's okay with you, I'm gonna go ahead and do a head-to-toe physical assessment.
sure thing.
All right. Can I go ahead and see your name band here? Can you give me your full name and your date of birth?
Lydia Brooke Latimer,
Okay.
January 22nd, 1997.
Good. And I see that you have an IV here, and I don't see any redness or swelling. Is it tender at all?
No.
Okay, great. All right, so the first thing I'm going to do is have you give me a big smile. I'm going to check the symmetry of your face, and it looks perfect, just beautiful. Okay, and now I'm going to go ahead and assess your breathing. Can you go ahead and take one of your fingers and cover one of your nostrils and just breathe out of that nostril? Can you go ahead and do that for me? Okay, and do the other side. Okay, fantastic. Now I'm going to go ahead and I'm going to see what your sight and your hearing is like just from a little bit of a distance here, okay?
Okay.
Can you tell me how many fingers am I holding up?
2.
All right, great.
2 indexes.
That's right. Couple of orientation questions. Can you tell me where you're at?
Harris Methodist,
Okay, and what is the date today?
March 2nd, 2017.
Okay, and about what time do you think it is?
8.
Okay, so right now I'm going to go ahead and take a look inside your mouth here. I want to look on your tongue and underneath your tongue. Stick it out for me and lift it up for me. Okay, now I just need to see the sides of your tongue here. Good, and the other side. Now I'm just going to take a look at your cheeks here. Great. Everything looks pink and moist. I don't see any lesions in her mouth. Good. Okay, the next thing I'm going to do is listen to your lungs.
Okay.
Okay? So I'm going to have you just go, or you can use it through your nose and out your mouth. Okay? I'm going to be listening in 6 areas on the anterior portion here. Ready for me? Okay, great. Can I go ahead and have you sit up so I can listen to your back? All right, very good. Okay, there's going to be a total of 8 areas on the posterior back. Go ahead and breathe for me. Okay, and I'm going to just listen to 2 places on each lateral. All right, perfect. Her lungs were clear, no adventitious sounds noted. Go ahead and lay down for me, and I'm going to take a listen to your heart. First, I'm going to be listening to your aortic, then your pulmonic, herbs, tricuspid, and mitral valves. And I'm going to start with the diaphragm of the stethoscope. During this exam part, you can go ahead and just breathe normal. So yeah, let's count that out to the second intercostal space. Okay, I'm going to use the bell. Heart rhythm is regular, no murmurs or any abnormal heart tones noted.
Oh, right.
That's awesome. All right, so I'm going to continue to try to maintain your privacy as best I can. I'm going to lift your gown up. You have shorts on. Okay, and I'm just going to take a look at your abdomen here. Okay. All right, her abdomen is nice and flat, contoured, looks good. The skin on her abdomen is nice and smooth. I don't see any scars or lesions on there, and I did not see a pulse. So the first thing I'm going to do is auscultate your 4 quadrants. Have you been having any kind of abdominal pain?
No.
Okay. Sorry, I know it's going to be cold. I apologize. We're going to start in the right lower quadrant. It's important to listen for at least 5 seconds when you're assessing the auscultation portion. She has normal active bowel sounds. Next thing I'm going to do is percuss your abdomen, okay? So I'm going to do some tapping on your belly in all 4 quadrants, okay? Okay, and that sounded perfect. And the last thing I'm going to do is go ahead and is
I'm looking at the bright light
help
for so
paint.
long. It's
Okay,
my eyes
good.
are burning.
all right. If you have had some kind of abdominal pain, I actually would not have started in the right lower quadrant if that's where your pain had been. That would be the last place that you want to assess. All right. So did you have any tenderness during that? I didn't feel anything abnormal in there. Everything was nice and soft and non-tender. So I'm going to go ahead and put this back like this. And if you can go ahead and sit on the edge of the bed for me. Okay, and looking at her skin, she has nice pink tones. I don't see any erythema, jaundice, and I don't see any kind of swelling. Okay, now I'm going to check the temperature using the dorsal portion of my hands. Okay, and it's nice and warm to the touch. All right, let me go ahead and check your pulses here. Okay, those are 2+. And for cap refill, since she has nail polish on, I'm going to use the tips of her fingers. And we are doing all 10 digits. Nice brisk cap refill at 2 seconds or less. Okay, and I'm going to go ahead and check your range of motion and then your strength. So if you can bring your arms out here like this, and then turn them over. Great. Now I'm going to put my hands here, and I want you to bend at the elbows and try to bring your arms to you. Good. Good strength. All right, bring them toward me. Good. Okay, so she was about a 4 out of 5 for strength on her arms there. Okay, now we just take a look at your legs. She has nice, good pink tones, no jaundice or erythema noted. I don't notice any swelling, but I'm going to go ahead and test for that here. Okay, no swelling noted, but the best way to check for that is to measure 4 places on the leg with a centimeter measure tape. And let me go ahead and check your pulse on your dorsalis pedis. Okay, 2+ there. And let's check cap refill. She does not have nail polish on her toes, so I'm going to go ahead and do it over the nail beds. Pinching hard. Ow. Okay, brisk cap refill at less than 2 seconds for each one. Okay, can you go ahead and extend your leg out for me? Good, and bring it towards you. Okay, and then earlier in the assessment, I did not ask your pain level or if you had any pain. Are you currently experiencing any pain?
I'd say a 5 to 6.
So you're
In my lower
experiencing
back.
some pain?
In my lower back.
On a scale of 0 to 10,
Oh.
0 being no pain, 10 being the worst ever.
Oh,
would
okay,
you
5
rate?
to 6.
Okay, very good. Okay, and when you
Out of order.
when you hurt your back, did you have any numbness or tingling in your legs?
Well, I was slightly paralyzed in that leg for a
Okay.
good 2 months.
All right, well, let's test the strength on that, okay? I'm going to put my hands here, and I want you to push your legs toward me. Okay? All right, good. And then I'm going to bring my hands like this, and I want you to try to push your legs towards you. Okay, very good. So the leg strength on there, her left is stronger than her right. Her left leg is a 3 out of 5, and her right leg is a 2 out of 5. Okay, we are done with your assessment. I can go ahead and have you lay back down, and I'm going to get you covered back up. Give you your call bell. Make sure your bed is in the low position. Is there anything else you need or I can do for you before I leave? She needs one thing.
I do need one thing. I need it.
Oh, she needs the baby.
The only medicine I
The
need.
baby. Yes, that's on the other there. All right, y'all. How can you not enjoy that for the end of the assessment? Yes.
If everyone got a puppy at the end of their assessment, everyone would be in nursing school.
That's right. Okay, thank you. Bye, y'all.
Bye.